The neglect that the military, the way they've detailed it, sounds a lot like criminal negligence.
NDP leader Jagmeet Singh outraged at the details of two scathing reports from Ontario and Quebec long-term care homes. Singh pitching to take the privatization out of the long-term care equation.
The type of scenario, the horrible, appalling details would not have happened in a hospital for a very clear reason. Hospitals aren't built to create profit. They aren't made to make money off the backs of patients.
The explosive military reports detailing deplorable conditions in Ontario and Quebec care centres has politicians and advocates asking, how could this happen?
Well, we're going to be inspecting all those homes right across the board. We're going to do rigorous inspections, and we're going to find out very clearly and very quickly who are good operators and who are bad actors.
The majority of COVID-19 related deaths have occurred in long-term care homes, but some provinces like Ontario and Quebec have been much harder hit by the virus than those in BC.
They limited travel much sooner than Ontario did. Remember, they also restricted care workers from working at multiple homes 2 weeks before Ontario and Quebec both did.
Others believe politics played a role in how residents in BC care homes are faring better.
And I think the different politicians, the different parties have, rather than working against each other, are working together.
Long-term care homes are the responsibility of provinces, creating a patchwork of different practices and policies across the country.
I do know that in BC, 75% of residents have single rooms. And I would venture a guess that the percentage is much larger. The percentage of people sharing rooms is much larger in Ontario, I would guess that.
The disproportionate outcomes have the NDP and advocates calling for federal support. The Prime Minister maintaining a line in the sand between the feds and provinces.
Well, the immediate plan is to help out immediately. That's what we're doing with the military. That's why we're working very closely with the provinces on looking at how we can ensure that they have the resources needed to get these care centres properly serving the elders who they care for.
While the fallout of what went wrong will continue, advocates say the current priority is keeping our vulnerable senior community safe as the pandemic continues. In Ottawa, Nigel Newlove, City News.